Hello, I'm Dr. James Wilson, and I'm going to walk you through a complete, calm, and practical morning routine designed for adults over 65 who want to lower blood pressure naturally and start each day with steadier numbers, clearer focus, and a steadier mood. Everything here is laid out in smooth, readable paragraphs so you can use it as a voiceover script, a handout, or a personal guide. The routine itself takes about 10 minutes, but I'll also give you the reasoning behind each step, gentle modifications for common mobility concerns, and suggestions for how to fit medication timing, breakfast, and home monitoring into one easy flow. My goal is that you can wake up tomorrow and do this without stress, without special equipment, and without second-guessing whether you're doing it right. We'll begin with how your body wakes up, what happens to blood pressure in those first minutes, and why a calm start can make a difference equal to what many people see from a single medication. Then we'll turn that science into simple steps you can repeat daily. Blood pressure is often highest in the morning. Your body runs on a 24-hour clock called the circadian rhythm, and in the early hours, your adrenal glands release hormones like cortisol and adrenaline to help you wake. Those hormones are helpful for getting moving, but they also narrow blood vessels and quicken your heart. For younger people, the cardiovascular system usually handles that surge easily. After 65, though, arteries tend to be stiffer, and the tiny stretch sensors in your vessels, the baroreceptors, don't adjust as quickly as they once did. That means a fast jump from lying down to standing, paired with a hit of stress the moment you check your phone or think about the day's tasks, can create a spike that's higher and more uncomfortable than it needs to be. The routine you're about to learn acts like a soft ramp instead of a staircase. Rather than jolting your heart and vessels first thing, you give them a gentle, predictable path from sleep to wakefulness. That predictability teaches your nervous system that mornings are safe. Over time, most patients notice not only lower numbers but also fewer dizzy spells, fewer head rush moments on standing, and a calmer start that carries through the day. The very first minute after your alarm is where the whole routine begins. When the alarm sounds, resist the old habit of sitting up quickly. Instead, open your eyes and spend a full minute breathing slowly while you remain on your back. Feel the mattress under your shoulders. Notice your breath without forcing it. A calm, slow inhale through your nose and a gentle, unhurried exhale through your mouth immediately signals the parasympathetic branch of your nervous system, the rest and settle system, that you are safe and can wake without a surge. After several slow breaths, roll onto your side. Pause there for 30 seconds. That pause is not wasted time. It's a gift to your baroreceptors. They're recalibrating from a horizontal world to a vertical one. Now press up to a sitting position. Place both feet on the floor. Sit for another 30 seconds before you stand. People are often surprised how much difference this small sequence makes. If you've ever stood quickly and felt the room tilt or your vision narrow, you've met orthostatic changes in blood pressure. By letting your body transition in steps, back to side to sit to stand, you reduce that sudden drop and the reflexive surge that follows it. As you sit at the edge of the bed, reach for a glass of room temperature water that you placed on your nightstand the night before. Drink about 10 ounces. Overnight, you've gone 6 to 8 hours without fluid, so plasma volume dips a bit. That's one reason morning blood is slightly thicker and flow a little more resistant. A glass of water brings volume back toward normal, eases the workload on your heart, and helps your kidneys begin their daytime job. Choose room temperature water, because very cold water can briefly trigger a tightening of vessels in some people. If you like a hint of flavor, add a squeeze of lemon or a few cucumber slices, but keep it simple. If your cardiologist or nephrologist has you on a fluid restriction, follow that guidance and ask what morning amount is appropriate for you. Patients often tell me that this single habit, water before anything else, makes them feel awake without the jolt they used to rely on from their phone or the news. So once you've hydrated, you'll practice slow, deliberate breathing for 2 minutes. I recommend what's often called resonant breathing, roughly 6 breaths per minute, because it's simple to learn and reliably calms the cardiovascular system. Sit with your feet flat and your back supported, Rest one hand on your chest and the other on your belly so you can feel where the motion is coming from. Breathe in through your nose for a slow count of 5, letting your belly rise. Breathe out gently through pursed lips for a slow count of 5, letting your belly fall. Aim for 2 relaxed minutes. If counting makes you anxious, simply make your exhale slightly longer than your inhale. This still activates the vagus nerve, lowers heart rate, and encourages your blood vessels to soften and open. Many people feel a warmth in their shoulders or a quieting in their mind after 90 seconds. That sensation is your body switching from fight or flight to rest and digest, which in turn reduces the size of the morning blood pressure surge. After your breathing, stand up slowly and move your body with 3 gentle stretches. These are not workouts, they're signals. Morning tissues are stiff, fascia is cool, and vessels are more resistant. Small, careful movements invite circulation and reduce vascular stiffness. Begin with your neck. Drop your chin toward your chest and slowly trace a half circle to the right shoulder, back through center, to the left shoulder, and back again. Make the circles smooth and small. Then lift your shoulders toward your ears, hold for a count of 3 and relax them back and down. Repeat several times. Finally, with feet hip-width apart and hands resting lightly on your hips, rotate your upper body to the right, hold 3 seconds, return to center, and rotate to the left. Keep the motion tiny and comfortable. If you use a cane or feel unsteady, keep one hand on a sturdy surface like a dresser or countertop. If standing is difficult, do seated versions of all 3 moves. Nod and arc your head gently, roll and relax your shoulders, and turn your chest softly side to side. The goal is to lower tension, not to push through discomfort. When this feels good, you can add a minute or 2 of easy marching in place or a slow walk down the hallway, but it's optional. Before you touch your phone, set a short intention out loud. People sometimes chuckle at this step until they've done it for 2 weeks and discover how it shifts the entire tone of the morning. The intention is short and clear. Today I choose calm and steady. I'm caring for my heart with simple steps. I move at a healthy pace and let tension go. Speaking it out loud matters. Your brain treats spoken words as commitments, and the act of choosing a direction lowers stress reactivity later in the morning when a surprise phone call or appointment threatens to pull you off balance. If you live with someone, you can say it together. Shared routines tend to stick. If your clinician has asked you to check your blood pressure at home, take your reading now. Sit quietly for at least 1 minute before you start the monitor. Keep your back supported, feet flat on the floor, and your arm at heart level on a table or pillow. Don't talk while the cuff inflates. I like 2 readings 1 minute apart, and then I average them. Write down the date, time, and numbers in a simple notebook. It's not a test, it's a record. The value of home monitoring is in the trend across days and weeks, not any single number. Most people notice that readings taken after this routine are a few points lower and much steadier than those taken the instant they wake up. Now let's fit medication timing and breakfast into the flow. Some medications, thyroid pills are a classic example, need to be taken on an empty stomach 30 to 60 minutes before eating. If that's you, drink your morning water, do your breathing and stretches. Then take your pill with a sip of water and set a simple timer for breakfast. Blood pressure medications vary. Some are better in the morning, others in the evening, and some, particularly in people with morning surges, can be split or timed to smooth the early spike. This is individualized. Bring 2 weeks of home readings to your next appointment and ask whether the timing you're using is optimal for your pattern. For breakfast, think fiber and potassium with modest sodium, oats or other whole grains topped with berries, a spoon of ground flax or chia, and a handful of unsalted nuts, or eggs with sautéed greens and whole grain toast. If you drink coffee or tea, have it after the 10 minutes. Caffeine can nudge pressure up briefly, and we want your new, calmer baseline established first. People often ask how long it takes to see results. Relief in how your morning feels, less rush, less head rush, fewer startle moments, often shows up in day 1. Numerical changes usually emerge over 1 to 2 weeks. If your old pattern was checking the phone first, standing fast, and moving quickly to the kitchen or bathroom, you were essentially instructing your cardiovascular system to leap. Now you're teaching it to stroll. The human body learns patterns quickly when we are consistent. The nervous system loves predictability. Your vessels respond with stability. What if your mornings are chaotic? If you're a caregiver or your phone demands your attention early, keep the routine but scale it. Do the slow wake-up before your feet touch the floor. Even 3 slow breaths while you're on your back will blunt a spike. Drink a smaller glass of water at the bedside and do 1 minute of calm breathing in the chair by the door. If there's time, roll your shoulders and set your intention as you put on your shoes. The smallest, most consistent pieces do more for blood pressure than a perfect routine you can't maintain. On days when everything goes wrong, treat the evening as a reset. 10 minutes of slow breathing and gentle stretches before bed improve sleep quality and make tomorrow's morning easier to protect. If you wake during the night, use a mini version of the routine when you get up to use the bathroom. Pause before you sit up. Take 3 slow breaths. Sit and let your feet find the floor. Pump your ankles a few times. Rise with one hand on a stable surface. These small steps prevent repeated surges and reduce dizziness. If you often feel faint or see stars when you stand, tell your clinician. Medication adjustments, compression stockings, or hydration changes may be needed. Let's address common concerns I hear in clinic. If you have arthritis in your neck or shoulders, reduce the range of your stretches and keep the motion smooth. Imagine oiling a hinge, not forcing a stuck door. If your balance is unsure, keep your movement seated or supported. If you use a walker or cane, do the breathing and intention steps first. Those give you the most cardiovascular benefit with the least risk. If counting your breaths makes you tense, set a 2-minute timer and simply lengthen your exhale relative to your inhale. If you're new to home monitoring, bring your cuff to your next visit so we can compare it to the office reading. That ensures your device is calibrated and your cuff size is correct. Because this is a morning routine designed to complement your treatment, a brief word about salt, potassium, and hydration is helpful. Sodium pulls water into your bloodstream, increasing volume and pressure, while potassium helps the kidneys excrete sodium and relaxes vessel walls. Many older adults do better when breakfast and lunch are lower in sodium and higher in potassium-rich foods like berries, leafy greens, beans, yogurt, and bananas. Hydration should be steady rather than in big gulps. The morning glass sets the tone, then sip water through the day, unless you've been told to restrict fluids. Alcohol in the evening, particularly in larger amounts, can disrupt sleep and raise morning pressure for some people. So if your home log shows higher numbers after certain nights, note what you drank and discuss patterns with your clinician. To help you lock this in, use a simple 2-week ramp. For the first 2 days, practice only slow wake-up and water. On days 3 and 4, add the 2 minutes of breathing. On days 5 through 7, add the light stretches and speak your intention out loud. In the second week, keep all steps in a consistent order at roughly the same time. By days 11 and 12, add a 3-minute hallway walk if you enjoy it. By days 13 and 14, review your notes. Look for fewer spikes and a slightly lower average. Avoid judging single outliers. Focus on the smoothness of the line you're drawing over time. If you're not seeing improvement, that's worth celebrating too, because it means you've built a controlled experiment you and your clinician can learn from. We can change medication timing, look at evening habits, or add a short afternoon breathing break to reinforce what you do in the morning. Here's what a calm morning might look like in practice. Your alarm chimes at 6:45 a.m. You let it ring twice, then silence it. You stay on your back and take 5 slow breaths, counting each exhale in your mind. You roll onto your side, pause, and then press yourself up to sitting. Your feet find the rug. The glass is waiting. You drink 10 ounces of water and feel your mouth moisten, your chest open. You sit with one hand on your belly and breathe slowly. 5 counts in, 5 counts out, for 2 minutes. The room seems quieter now. You rise with a hand on the dresser. Your neck draws 3 small arcs each way. Your shoulders lift and fall. Your trunk turns a little right, a little left. You speak your intention softly. Today I choose calm and steady. You sit again for a minute, then take your reading. You write the numbers down. The clock says 6:55 a.m. You've only been awake 10 minutes, but your day already feels different. You take your medication as prescribed, open the blinds, start breakfast, and let the morning sunlight remind you that consistency is powerful. Because safety matters more than anything, let me name the red flags. If you ever feel chest pressure, crushing pain, shortness of breath out of proportion to activity, sudden weakness, trouble speaking, or severe headache with very high readings, seek care immediately. If you frequently faint or feel as if you might, sit or lie down right away and tell your clinician as soon as possible. If you are adjusting medications, never stop or change a dose without guidance. The routine supports therapy. It does not replace it. These paragraphs are educational and meant to help you build habits that make your treatment plan work better and feel better. Travel will inevitably disrupt your schedule, but this routine travels well. In a hotel or a relative's guest room, place a bottle of water on the nightstand, keep your phone on, do not disturb until you finish breathing, and use a chair for neck and shoulder stretches if you don't trust the unfamiliar floor. Time zone changes can nudge blood pressure up for a few days. Your calm start helps the body adjust. If you're driving early, do the slow wake up, drink, and breathe in the driver's seat before you start the engine. You might appreciate how these morning minutes echo through the rest of the day. People who begin with slow breathing often find it easier to pause before reacting to a stressful email or phone call. That pause is not just mental, it's vascular. The same nervous system pathways you strengthen in the morning remain available at noon and at 4 in the afternoon. A 1-minute breathing break before a difficult conversation, before a medical appointment, or after reading the news helps prevent stress-driven spikes. You're not aiming for a life without stress. You're building a body that absorbs and releases stress without punishing your arteries for it. If you're supporting a spouse or parent with memory problems, you can adapt this routine into a shared practice. Place the water where it's visible. Breathe together for 1 minute instead of 2. Do seated shoulder rolls and speak a joint intention. We start soft. We start steady. Caregivers often discover that these tiny rituals protect not only their loved one's blood pressure, but their own. 10 minutes may feel like a lot on hard mornings, but the return on investment is real. Calmer starts, steadier numbers, and better energy by late morning. To deepen the benefits, pair your morning routine with a simple evening wind down. The nervous system likes bookends. 15 minutes before bedtime, dim the lights, set your phone aside, and do a minute of slow breathing and a few gentle stretches. If you often wake at night, avoid heavy late meals, keep the bedroom cool and dark, and reserve the bed for sleep. Even a modest improvement in sleep quality lowers morning pressures for many people. Then, when your alarm rings, the routine is waiting for you like a familiar friend. As the weeks pass, you may notice subtle shifts beyond the numbers. Standing up feels less precarious. Your shoulders drop sooner. The first sips of coffee feel pleasant rather than jarring. Breakfast tastes better when you're not rushed. You may even find that you read the morning headlines with a little more distance and a little less urgency. None of these changes require perfection. They ask for kindness and repetition. Miss a day, begin again. Miss a week, begin again. Health is practiced in the present. Let me leave you with a simple image. Imagine your arteries as a river at dawn. Overnight, the air cools, the banks are still, and a mist hangs over the surface. If you throw a heavy stone into that river the moment the sun rises, you'll send waves slapping against the banks. But if you wade in gently, the mist lifts softly and the water continues its steady run. Your morning routine is that gentle wading. Slow breath, a glass of water, a few careful movements, a quiet word to yourself. Each is a small kindness to the river you carry inside you all day. Start tomorrow. Place your glass tonight. Turn off notifications until you're done. Let your first act be your breath, your second be your water, your third be your movement, and your fourth be your intention. If you take a reading, write it down without judgment. If you don't, feel the steadiness in your chest and trust that you've already done something meaningful for your heart. This routine stands beside your medications and your clinician's advice, strengthening their effect, smoothing your days, and reminding you that, even at 65, 75, or 85, your body listens and responds to care. Remember that education is not a substitute for medical advice. Always consult your healthcare provider before starting any new routine, especially if you have cardiovascular conditions, take blood pressure medications, or experience dizziness or chest discomfort. With that understood, I want to encourage you. Small, thoughtful steps, repeated daily, are powerful medicine. Tomorrow morning, start softly. The rest of your day will thank you for it.